here is your time. There are 2 more slides. Once you've done reading, please tell me. I'll move on.
Can you
Yes, sure.
please next slide? Can you click next slide? Okay, ma'am.
Next.
Yeah, next. Okay, ma'am.
All right. So if you've read and understood, considering it communication skill station, please begin.
Hello, good evening. I'm Dr. Sudarshan, working at Extreme and Emergency. I'm calling to speak with trauma head regarding and to give update about trauma case. Can I confirm that I'm talking with Dr. Ali Had, trauma consultant?
Yes, please summarize your case.
25, we have 25 years old male who has presented to emergency with history of road traffic accident, and initially his DCS was at the moment his DCS honorable his DCS is 15, and it was unconscious initially, and yeah, he's hemodynamically stable, and on examination his X-ray shows right tubular open fracture, and ultrasound shows free fluid in paracolic gutter, and on the nurse informed me there is patient has suddenly cold and pulseless extremity. So I'm calling to inform you about this case regarding patient might need urgent vascular intervention.
Okay, doctor, can you please tell me what's most urgent in this patient?
Because patient has open tibiofibular fracture and there is vascular disruption of vascular continuity, and patient has cold and pulseless distal patient has cold and pulseless distal pulses, and with worsen in pain. So we need to avoid any ischemic and compartment syndrome and possible amputation. This patient needs urgent intervention.
Okay, what are the causes of pulseless foot?
The causes are vascular injury, vascular discontinuity, and thinning of vessels, compartment syndrome.
Okay, is the patient wearing a collar?
At the moment, I don't know. I will update you regarding this thing.
Okay, what about the abdomen?
Abdomen, there is left side abrasion and the left side abrasion of the left side of the abdomen, and on scan shows there is a collection in the paracolic gutter.
Okay, and do you think patient is dehydrated?
I'm sorry, regarding this thing also I will update you once I'm off the phone.
Okay, what would be your plan of action?
I will inform orthopedic consultant and vascular surgeon. Then I will fix and immobilize the fracture. Then I will send CT head and neck of CT head and neck. Then I'll CT abdomen pelvis. Along with I will send duplex ultrasound. Then CT angiogram.
Okay, and what about the cervical immobilization? Would you do that?
Um, first I will do the primary survey, and if there is any cervical tenderness, then I'll do cervical immobilization with triple immobilization technique with cervical collar, sandbag, and tape. And also I will also send the cervical X-ray, chest X-ray, and pelvis X-ray.
Okay, and what is the missed investigation that you would like to do?
Sorry.
What is the missed investigation that you would also like?
Uh, I will send fast scan since there is left nephrogen on the left side. Oh, sorry, I have already mentioned. I'll
Anything?
send.
It's the angiogram he's talking about, CT lower limb angiogram.
I have already mentioned.
Yes, all right, continue.
Okay, and why are you calling me?
Because patient need urgent intervention regarding from orthopedic consultant and vascular surgeon, and patient might to prevent from amputation since patient has presented in accident and emergency department less than 6 hours. And there is also on fast scan, it has shown there is fluid collection in the abdomen with left hand tenderness and abrasion.
Okay, thanks for letting me know. Keep me updated about the patient. Thank you.
Wait,
Okay.
who would you involve in this patient, pre-operatively or intraoperatively?
I will inform OT team,
Yes, and
orthopedic consultant, vascular surgeon, plastic surgeon, general surgeon, anesthetist, and pre OT. I will involve family member for the possible decision
okay.
and consent from them.
Why would you ask for plastic surgeons? Why would you need them?
Patient has open tibial fibular fracture,
Yes.
and patient might need flap repair or skin graft, like if for example split thickness skin graft.
Okay. Can you please tell me why did the general surgeon ask for ultrasound when the abdomen was not tense?
Because there was abrasion over left side of the abdomen, so
Yes.
possibly splenic intra-abdominal splenic hematoma or other intra-abdominal injury to rule out other intra-abdominal injury.
Why else would you need to consult with general surgeon?
First thing, patient has wound
Yes.
because of open tubular fracture, and patient might go for compartment syndrome.
Yes.
And patient has also left abrasion over left side of the abdomen, and might need emergency exploratory tracheotomy.
All right, good. All right. Before the arrival of the vascular consultant, what would you be taking care of with regard to this patient?
I will resuscitate the patient. Then I will give I will do external fixation and splinting of the fracture so that the soft tissue and realignment of wound can be maintained, which will not damage neurovascular structure and possible for later
Are you
possible for
telling
later
me about
treatment.
for the vascular consultant or for the orthopedic consultant? Okay, what exactly would you do for this patient before you'll send off this patient to the operation theater?
I will inform all the consultant
You've
or
informed,
orthopedic.
yes,
Okay.
but with the
Then
patient.
with the patient, I will do antiseptic dressing and bandaging. I will give analgesics. I'll
Analgesia
give
and IV fluids, yes.
IV fluid,
And you'll secure the wound
tetanus
through
toxoid,
yes, tractions and all that. Okay.
traction.
Right. When would you do the wound debridement for this patient, and why would you do it before the arrival of the consultant?
Before transfer patient to OT, I'll do this antiseptic dressing and debridement of the necrotic tissue.
Why not in OT?
Because it is open wound means contaminated wound, so we have to do before transfer to OT.
Thank you.
Thank you.